Hello and welcome, Essex County College family. This is the Virtual Cafe powered by Student Life and Activities. We hope you're doing well during this season. Today's episode number 54 is World AIDS Day Awareness. Now, every December 1st is World AIDS Day at Essex County College. We like to highlight some of the key facts about HIV and AIDS, and also we like to provide a giant list of different areas and places that you can get tested for HIV, AIDS, other STDs, and various other things as well. Now, obviously, we have a global pandemic occurring as we speak, but we cannot forget about the epidemics that have plagued our world for decades now. There's a lot of people living with HIV and AIDS in this country, and a lot of them have been able to manage their disease with a lot of the great medicines and therapies that we have available. And a lot of times HIV can be treated early and before it develops into AIDS, due to early detection and getting screened and getting tested. So these are all important things for you to do, especially college students. This is an important practice. You should be getting tested for STDs regularly, but HIV and AIDS is no joke, and there's plenty of places for you to get screened. So this resource will be available for you on our YouTube page, SLAO Essex. Please refer to it anytime that you need to. All the information that we're giving you is updated for the year 2020, and it uses some of 2019's facts and figures to get us that information. We have with us today Director of Student Life and Activities, Mr. Jamil Graham. Jamil, how are you doing today?
I'm doing well today, Joe, and yourself?
All right. We thank you for joining us. Students, we are going to present to you some information about HIV and AIDS. So let's get to it. Some key facts about HIV and AIDS. Number one, HIV continues to be a major global public health issue, having claimed almost 33 million lives so far. However, with increasing access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives.
There were an estimated 38 million people living with HIV at the end of 2019.
As a result of concerted international efforts to respond to HIV, coverage of services has been steadily increasing. In 2019, last year, 68% of adults and 53% of children living with HIV globally were receiving lifelong antiretroviral therapy, ART.
A great majority, around 85%, of pregnant and breastfeeding women living with HIV also received ART, which not only protects their health, but also ensures prevention of HIV transmission to their newborns.
At the end of 2019, an estimated 81% of people living with HIV knew their status. 67% were receiving antiretroviral therapy, ART, and 59% had achieved suppression of the HIV virus with no risk of infecting others. About 30 million adolescent boys and men in East and Southern Africa have received VMMC services.
By June 2020, 26 million people were accessing antiretroviral therapy, marking a 2.4% increase from an estimate of 25.4 million at the end of 2019. By comparison, treatment coverage increased by an estimated 4.8% between January and June of 2019.
The number of new people starting treatment is far below expectation due to the reduction in HIV testing and treatment initiation and ARV disruptions that occurred during the COVID-19 pandemic. By the end of 2020, testing and treatment rates showed steady but variable recovery.
Nevertheless, between 2000 and 2019, new HIV infections fell by 39%, and HIV-related deaths fell by 51%, with 15.3 million lives saved due to art. This achievement was the result of great efforts by national HIV programs supported by civil society and international development partners.
But success has been variable by region, country, and population. However, not everyone is able to access HIV testing, treatment, and care. Notably, the 2018 super fast track targets for reducing new pediatric HIV infections to 40,000 was not achieved. Given prior to the COVID-19 pandemic, reduction of new infections and deaths has plateaued. Global 90-90-90 targets for 2020 are at a risk of being missed unless rapid action is taken.
Due to gaps in HIV services, 690,000 people died from HIV-related causes in 2019, and 1.7 million people were newly infected.
To reach the new proposed global 95-95-95 targets, we will need to redouble our efforts to avoid the worst case scenario, 500,000 excess deaths in sub-Saharan Africa, increasing HIV infections due to HIV service disruptions during COVID-19, and the slowing public health response to HIV.
Interventions will need to focus on the populations left behind. Key population groups and their sexual partners accounted for over 6,620% of all new HIV infections globally among the age group 15 to 49 years in 2019. And Eastern European and Central Asia, Asia and the Pacific, Western and Central Europe, and North America, and the Middle East and North Africa. These groups accounted for over 95% of new HIV infections in each of these regions.
The World Health Organization defines key populations as people in populations who are at increased HIV risk in all countries and regions. Key populations include men who have sex with men, people who inject drugs, people in prisons and other closed settings, sex workers and their clients, and transgender people.
Increased HIV vulnerability is often associated with legal and social factors, which increases exposure to risk situations and creates barriers to accessing effective, quality, and affordable HIV prevention, testing, and treatment services. Prioritizing key populations in the HIV response with appropriate interventions would have the biggest impact on the epidemic and reduce new infections.
In addition, given their life circumstances, a range of other populations may be particularly vulnerable and at increased risk of HIV infection, such as adolescent girls and young women in Southern and Eastern Africa and indigenous peoples in some communities.
Over 2/3 of all people living with HIV live in the WHO African region, 25.7 million in fact. While HIV is prevalent among the general population in this region, an increasing number of new infections occur among key population groups.
HIV can be diagnosed through rapid diagnostic tests that can provide same-day results. HIV self-tests are increasingly available and provide an effective and acceptable alternative way to increase access to people who are not reached for HIV testing through facility-based services. Rapid tests and self-tests have greatly facilitated diagnoses and linkage with treatment and care.
There is no cure for HIV infection. However, effective prevention interventions are available, preventing mother-to-child transmission, male and female condom use, harm reduction interventions, pre-exposure prophylaxis, post-exposure prophylaxis, voluntary medical male circumcision, and antiretroviral drugs, which can control the virus and help prevent onward transmission to other people.
Science is moving at a fast pace, and there have been 2 people who have achieved a functional cure by undergoing a bone marrow transplant for cancer with reinfusion of new CD4 T cells that are unable to be infected with HIV. However, Neither a cure nor a vaccine is available to treat and protect all people currently living with or at risk of HIV. Now, we've gone over all the key facts from the World Health Organization about HIV and AIDS. Now we're going to go over local testing sites in and around Essex County and Essex County College for all of our students. This is the ultra list right here. I'm sure you will be familiar with at least one of these places from having to go there for care for a myriad of other different health issues over the years. So here is our definitive list of HIV and AIDS testing sites around Essex County. We have the City of Newark Department of Health and Community Wellness. We have the Newark Community Health Centers Incorporated, the City of Newark Department of Health and Community Wellness. Now, if you notice, we have all the addresses and phone numbers listed here, so make yourself an appointment if you need to. We have Planned Parenthood of Metropolitan New Jersey in Newark, the St. Michael's Medical Center in Newark, the Planned Parenthood of Metropolitan at a different location in Newark, the African American Office of Gay Concerns in Newark. We have the Rutgers NJ Medical School right around the corner. Rutgers, New Jersey Medical School. I'm guessing a different building, a different office also does testing. There it is. Rutgers University in general. The Hyacinth AIDS Foundation. It's in Newark. The North Jersey Community Research Initiative in Newark. Rutgers School of Nursing in Newark. The Planned Parenthood of Metropolitan, that's in East Orange. We have the East Orange Department of Health and Human Services. The Newark Community Health Centers Incorporated. The Smith Center for Infectious Diseases and Urban Health in East Orange. RWJ Barnabas Health in Newark. The Hyacinth AIDS Foundation in Jersey City. The Zufall Health Center in Newark, in West Orange, excuse me. Empire Medical Associates in West Orange. Empire Medical Associates in Maplewood. The Newark Community Health Centers Incorporated in Orange. Newark Community Health Centers Incorporated in Newark. Empire Medical Associates in Belleville. Newark Community Health Centers Incorporated in Irvington. The Newark Community Health Centers Incorporated in East Orange. The Trinitas Regional Medical Center in Elizabeth. The Planned Parenthood of Northern, Central, and Southern New Jersey in Elizabeth. Spectrum Healthcare Incorporated in Jersey City. Hudson Pride Center in Jersey City. Planned Parenthood of Metropolitan in Montclair. The Hyacinth AIDS Foundation in Jersey City. Infectious Disease North in Nutley. Puerto Rican Organization for Community Education and Economic Development, Proceed, in Elizabeth. The Proceed is also at another location in Elizabeth, one on Dickinson Street and one on Grand Street. CVS Minute Clinic in North Arlington. Now Med Walk-in Urgent Care in Jersey City. Barnabas Health in Jersey City. The Jersey City Division of Health. The North Hudson Community Action Corporation in Jersey City. The Alliance Community Healthcare in Jersey City. Mountainside Medical Group in Nutley. Barnabas Health Medical Group in Lyndhurst. Riverside Medical Group in Secaucus. The Prompt MD Urgent Care 4 in Jersey City. Empire Medical Associates in Springfield Township. CVS Minute Clinic in Cedar Grove. And that about rounds up all of our testing sites. As you can see, there was about 30 different locations, which I'm sure you're familiar with at least a couple of those in other hospitals and other clinics. These are very, very valuable resources, and we're lucky to have so many around us because, as you learned earlier, In other countries and other areas of the world, testing is not as prevalent as it is here. So early detection is very, very entirely possible and hopefully a likely outcome for anyone affected by this terrible disease. So keep in mind, this list is here for you or anyone that needs it at our YouTube page, SLAO Essex. This video will be up. So if you need to access that information, we figured it would be better than just giving you a list. You can always access this video and pause the video whenever you need to and jot that information down. Dr. Graham, do you have any parting words for World AIDS Day to Essex County College students?
Just to always keep in mind that getting tested and knowing your status is just as important as anything else. And, as always, we look forward to returning to in person with you all. And quite a few of these partners on this list actually come to campus and help provide those services for free to you all. So just make sure you get tested, know your status, all right? And take care of yourself in general.
All right. We'd like to thank you all for tuning in to the virtual cafe today. We want to remind you to stay safe during this holiday season. Cover yourself up when you go out. And please, please, please make sure to stay safe and keep your family well, because we are looking forward to seeing you after the new year at some point when we resume in-person education. Please stay well until then, and we will catch you on the next time. Take care.